We've talked a lot, Gregory and I, with our guests here on Healthline about the effects of stress on the body. What do you see as the link between stress, this kind of emotional and psychological stress that comes about in bad economic times that we're experiencing now, and incidents of physical maladies?
Well, it can come in all shapes and sizes, and a lot of times people don't even understand their own bodies enough to understand that the stress they're feeling psychologically is coming out physically, and they won't even get the connection. But basically anything from just fatigue during the day to insomnia and not being able to sleep at night, anxiety symptoms where they're feeling shaky or unstable, maybe even to the point of panic attacks where they're having chest pain, shortness of breath, episodes where they feel like they can't go out anymore, even problems with eating and drinking, not eating the right foods. They're not taking care of themselves.
Well, they go for comfort food, and
comfort
food, which is the white sugars, which make you
Exactly.
overeat, and then you also don't work out because if you're not motivated and you're not working, why are you going to go out? And we mentally forget that we are basically like a car.
Right.
And we need to treat ourselves well.
You got it. And it's its own cycle. Because if you're not eating well and you're not exercising, you're going to feel worse and you're going to less likely eat well and exercise. And if you could just turn that back around and eat well and exercise more, you would probably be feeling much better, which is what I counsel my patients all the time. Please just eat better and exercise every day. And really, that's a pretty cheap form of medication if you could just do that.
You tell them to just do contrary action, to do something totally opposite.
I try.
Do you find that you're successful? And do you find, even though you may be losing everything, if you switch that mentality, you'll see the rainbow at the end of the road. You'll see something different.
Right. Well, first of all, with this kind of situation, I can't think of myself being successful. I think of myself as an advisor and trying to guide the patient into their own success. So the only person who can have the success here is the patient. Now, if I can guide them well enough, hopefully they will achieve that success. And yes, I have had patients who are in dire situations. People who have been hospitalized because of suicidality or suicide attempt, and they've been able to come through it, turn things around, and make themselves more healthy with or without medication, because you don't always need the medication to do this. So I have had definite successes, but I think far more often, unfortunately, these kinds of situations really breed a more unsuccessful situation where people just can't really get out of that cycle very easily, and something else tends to have to pop them out of it, or I never see them again, and that's really sad for me.
Do you find that a patient actually speaking their truth? You know what, I haven't worked for months, I'm afraid of losing everything. That once they actually speak it and put it out on the table in front of you, there's an awareness to, okay, wow, I just said that, and I'm really afraid to lose my job, and I'm afraid of this, and all these things, that there's actually an awakening to it, because you're actually speaking it. So you then go back to what we talked about earlier, just encouraging your patients to be that open with your doctor.
Right.
And say, this is what I'm feeling, this is what's hurting.
Right, just getting it out, just venting that feeling that you're having, just venting all of those issues that you don't know where to put them. Just getting it out of your system means that it's not going to turn into a physiologic state within you. And I really believe that's the case. And that's why if all they can do is come to me as their family medicine doctor, or if they can go to any kind of counseling, and that can be a psychologist, a therapist, any kind of family medicine counselor, Ayurveda practitioner, acupuncturist, whoever you want it to be, if you can just get some of that out of your system and start to work with it in a more healthy way, then you're going to be able to get through that situation that is so difficult for you. But you have to face it, accept it, and work through it and make it into something that's more healthy, and that takes work.
All the while not feeling sorry for yourself. All the while, we also have to remember too that feelings pass.
This too shall pass away.
This too shall pass. And also, if you're hurting at home, pay attention to what the doctor said about maybe forcing yourself, especially if your mind is in dire straits, about drinking water, eating your fruits and vegetables, eating healthy, and the more proactive you are, the more proactive your family's going to be, and then you're going to actually be able to see things clear.
Yeah.
And being aware of how easy it is to attempt to self-medicate through alcohol or through other addictive behaviors that we know are unhealthy. I mean, few people, I think, are unaware of the unhealthy aspect of drinking too much or smoking or these sorts of things. But it's a way that people comfort themselves, and this ultimately it leads to a further downward spiral.
Sure, and short term, those kinds of things really do make you feel better. Nicotine, cigarettes, they're a stimulant. They're going to wake you up. They're going to get you up and going when you feel depressed and low. Alcohol is going to make you feel more giddy for a period of time, but then keep in mind it's a depressant.
And then you drop.
And then you go down. Caffeine, even caffeine, gives you that high, and then you drop right after it. So you need more and more to keep that high going. So anything like that is really going to end up probably causing you more problems in the long run, unless done in moderation. And of course, things like cigarette smoking are never a safe thing to do. So
more of the viewer questions coming up. Also, we're going to look into this discredited study regarding a supposed link between childhood vaccinations and autism. The Lancet magazine had to recently retract this. We're going to be exploring that topic coming up. Stay with us.
Hi, I'm Gregory Zarian, joined with Suzanne Watley, and this is Healthline. Go, Tiger.
I can't wait to
Suzanne's
get to this
passionate
topic.
about this, so knock
With
yourself
our
out.
family medicine doctor, Katrina Miller here. Lancet retracts controversial autism paper. When I saw this the other day, I went, thank goodness, because in 1998, a British researcher named Dr. Andrew Wakefield had research published in the Lancet, the prestigious British medical journal, that caused a lot of parents to be concerned about the MMR, the measles, mumps, and rubella vaccine, and possibly causing autism in their children. This research has been discredited for a variety of reasons, and now, just this month, the Lancet has retracted it, which pretty much wipes out its legitimacy in the mainstream medical community. There are still many activist groups who are clinging to this notion, and I guess perhaps my own point of view is becoming clear by the way I'm speaking of it, because vaccination is extremely important for children, and the incidence of parents not having their children vaccinated increased from less than 1%, like 0.77% over 10 years ago, to just a few years later, over 2% decided, no, I don't want that vaccine. I don't want any vaccines that might cause autism in my child. There is no link now, according to several subsequent studies, and now the Lancet has discredited Dr. Wakefield's research. Dr. Miller, tell us what kind of effect in your family practice you have seen from this now discredited research.
Well, I say thank goodness for the fact that it finally came out, and the Lancet took 12 years to finally admit that, this wasn't really an appropriate statement or appropriate stance to take about the MMR vaccines and other vaccines in general. So I'm very happy to see this has actually happened. As you mentioned, unfortunately, there are still special interest groups who think that vaccines in general are not a good idea for their kids or for other people's children. And it's very concerning. What concerns me is the fact that people don't remember, and I certainly don't come from the era where I even remember the time where people actually got sick with things like measles or mumps or rubella or polio, and people were rendered disabled because of these illnesses. That doesn't happen anymore because of vaccines. We don't even know about that anymore because of vaccines. But if we stop giving our children these vaccines, that will come back. And there has been a resurgence of things like mumps, which you may have heard about in the past 2 years. There have been pockets where mumps has been coming up in the United States, and measles, and other illnesses like that will start affecting people and will cause long-term problems if we don't keep up with immunizations. Now, the good thing that we have going on is that the more children do get immunized, then we have something called herd immunity, meaning that those few children who don't get immunized because of their parents not wanting it to happen will still have protection because of all the children around them being immunized, so they will not be exposed to these illnesses. The only problem we have is, in this day of international travel, people can easily travel to a place where these illnesses are endemic, like Africa or China, and then become ill with those illnesses because they haven't been vaccinated for them, and even bring them back to the U.S. and then infect other children who are here.